Good evening, viewers. Far away from the exasperating frenzy of political heat before the West Bengal elections, assembly elections, ETV Bharat brings you a different story. It's a story of the fulfillment of a dream. It's a story of a doctor walking to achieve his goal. Here we have on studio today Dr. Srijon Mukherjee, the founder of Eastern India's first and only dedicated oral maxillofacial surgery hospital. Dr. Mukherjee, welcome.
Thank you. Yeah.
Now, let me begin with something of your past. As we all know that you have been, during your school days, you had been adjudged as the best NCC cadet. After that, with the vision of doing something for the country, as well as to change the society, you wanted to be an IAS officer. But ultimately, you ended up as a doctor, a successful doctor, of course. So why this shift? You were expected either to become an army officer, as your school batchmates believe. Then you wanted to be an IAS officer, but now ultimately, why a doctor?
Thank you. Very, very interesting question. Actually, I like the question. See, all the three has the same objective at the back of the idea. First of all, an army officer, as a very young kid, an army officer with all that power and that luster seems to be the person making a difference for the people of the nation. Very soon you realize that there's a limit to what an army officer single-handedly can do in terms of making a dent in the system. So with that, at that point, you come to know about these IAS officers, the people who are really the underlying decision makers, at least as we used to think at that time, of what is going to happen tomorrow for the country. Now, I was very fortunate. My father at the time was at Writers Building, and he was good friends to a lot of WBCs and IAS officers who were working there too. And I could call them uncles, and I could go to their office and talk to them when I was in class 11, 12 standard. And then I realized that they were not all extremely happy about their abilities to really change things, because there were other factors which were interfering so hard. Obviously, at that stage, at that age, they didn't tell me all the nitty-gritties and details, but it was very obvious that an IAS officer was not free to do as much good as they wanted for the country. So I returned, and I was looking into avenues, and again I had to talk to my dad, and it was finally decided that the doctor is the person who has got the advantage of moving out of his or her own, and at any given point of time they can sustain life and still work in the way they want to. And that work, by the very virtue of the nature of the work, that work is for others, as long as you want to keep it like that. And eventually, if you are happy doing it and if you are reasonably good at it, you end up in a position where you also have some say in the immediate society around you. And these were the three steps of maturity that brought me where I am.
So on this point, the obvious question comes that a medical professional has various fields. A doctor as a profession, there are various fields. The popular names that are that everybody knows, like cardiology, gynecology. But what made you choose this oral maxillofacial surgery line, which a term that the common people are not quite aware of, that like the fields like gynecology or cardiology?
Older fields. There are two reasons. Point one, in the country where we belong, everything is not left to choice. There are these exam systems, and according to your rank, you get a certain subject, following which comes a time. So these are the broader subjects.
Right.
Following which you get a choice out of a limited choice. It is not like a straightforward, I want to be this and I become that. Yeah, that is possible for the person who is first every time in every entrance exam. I was not that. So I was reasonably having a score. I was scoring a rank in the list, but I was not the topper. So situation was such that to me, because I was coming through the dental field, I was not through the general medical field. So from the dental field, there was only this one opportunity where I could really make it bigger than that typical dental chamber, a peaceful life with very little opportunity to venture into things which were considered to be very serious, big, and life-changing. So
Right.
this was my doorway into the territory which I liked. So that was point number one. Point number two was from the dental faculty, the different specialties that I could go to all led to dentistry.
Right.
Only maxillofacial surgery was the surgical specialty, which was open to a vast world. And yes, it was not very well known. So I would not try to be pretend that I am a hero and I chose a subject where I could put in a lot of effort to make it big. But I didn't have a choice, and when I was placed into it, into dentistry, I had to choose maxillofacial surgery because that was the only way out into the vast open world of medicine and surgery. And once I was there, obviously I had to put in my best to make it as much bigger as I could in my limited capabilities in the time and place that I belonged.
So, Dr. Mukherjee, on this point, I would like to explain you. I would like you to explain to our viewers, to the viewers of ETV Bharat, in slightly layman's language, what kind of services do the maxillofacial surgeon provide?
Perfect. It's a very important point that you brought up, and that is what would be a real help to the specialty through your media here. There are many fine nitty-gritties and differentiations which I would not go into. I will give you in about broad 5 headings what is the use of a maxillofacial surgeon to the society. Point number 1, which is pretty well known, are all the advanced dental scenarios. Advanced dental scenarios is what start after filling, scaling, extraction, and denture. After the standard dentistry, there comes the territory of severe infection that could even kill people to save the situation from that kind of scenario. Minor tumors and cysts of the jaw. So this is a vast area called dentoalveolar surgery. That is the bread and butter and the starting point of maxillofacial surgery. However, the maxillofacial surgery that we do starts from the next step, which is Craniofacial Traumatology. A big name again, but what all that means is fractures and other wounds of the delicate facial bones as well as the soft tissue of face. Face is a small area with too many important structures. Like a face has got much less area than one limb, but you can very well appreciate that every small part of the face has got its own importance. So an injury can traumatize, that traumatizes the face, can change a life. So the job of a maxillofacial surgeon, very precisely the job of a maxillofacial surgeon, I would reiterate why I mentioned this, is to fix a face which is tormented by some form of trauma. It could be a road traffic accident, which is the commonest, or it could be interpersonal violence, some industrial accident. Why a maxillofacial surgeon? Because due to our classical training pathway, we are trained to handle all the structures of head and neck area, obviously leaving aside the brain for the neurosurgeons, the whole of the rest of it, the skeleton of face is precisely taught throughout the training pathway of maxillofacial surgery, how to fix it proper. And there is no other specialty that spends so much of concentrated time on this area. So that is 2. Point number 3 are the huge field of oncology, head and neck oncology. We must understand that 40% of cancers of a human body in India are oral cancers, cancers arising inside the mouth for the different habits, for some genetics. So these cancers are covered and treated surgically by the maxillofacial surgeon. Not only cancers, but there are plenty of benign tumors which are non-malignant but tumors nevertheless. So those are also treated, including reconstruction of the lost parts due to surgery. So that's 3. Number 4 is, so you see the reconstruction is coming in. With this reconstruction comes correction of congenital anomalies or acquired anomalies. A child born with a cleft lip or palate are treated by a maxillofacial surgeon, or sometimes due to an accident there are deformities. The accident, immediate injury might have been treated by someone else, but the final deformity is corrected by the maxillofacial surgeon. And the last, but not the least, is the pure cosmetic area. Pure aesthetic and cosmetic surgeries of face and neck, and that's a vast area which has got many wings. When you can go for minimally invasive stuff like Botox, collagen, and all the way up to fixing, bringing the upper jaw forward or upper jaw, pushing it back, bringing the lower jaw forward, creating cheekbones better, making new noses better, like aesthetic value that you would like. These are done not only for the models and people in other forms of public performance. They're also done for normal people, because we must understand that self-esteem is one of the most valuable elements to any person, which is a newer feeling that is coming up in countries like ours. The Europe and America already knew this from a long time. Now are common people coming for stimulation of their self-esteem through facial, aesthetic, and cosmetic surgery. So these are the 5 main territories that a maxillofacial surgeon works in.
So on this point, that some people who are going for sex reassignment surgeries, SRS, I think maxillofacial surgery, I presume maxillofacial surgery has a role to play in the feminization of that face.
Absolutely, absolutely. There are plenty of things that are done for feminization of face, and there are special clinics. In my training pathway in UK, there was a certain hospital, though it is a government hospital, I cannot name it directly, but there are certain hospitals which have got special clinics. Yeah, back. So there are specific clinics for these feminization surgeries, and they are getting more and more popular. Yes.
So can you tell us about the average cost of maxillofacial surgery in your hospital? Now, before that, I'd like to ask you, are there enough maxillofacial surgery facilities in the government hospitals in our country?
Unfortunately not, because no place in India have got maxillofacial surgeons in district hospitals and such hospitals outside dental colleges. Usually dental colleges have got a postgraduate department of maxillofacial surgery, and the government facility normally is limited to there. Only in this state, in West Bengal, there is this one post, an honorary consultant maxillofacial surgeon's post, which I hold at Calcutta Medical College. That was a post which was actually born long time ago, but there was nobody in between. And I have been working in that post for last 4 years. So that is the other facility. Apart from that, it is purely in the dental colleges, and even maxillofacial surgeons are appointed in some government hospitals as dental surgical officers. They do not get an opportunity to be called as a consultant maxillofacial surgeon. So it's a little confusing state of affairs. We don't have the government facility for maxillofacial apart from dental colleges. So, and that means that, sorry to interrupt, that means there is a confusion here. The government or anybody can that way say that, well, there are facilities in the dental colleges, but you see the public perception gets confused, because somebody who is suffering from a cancer of mouth or a big tumor of parotid gland, of salivary gland on the side, or a baby born with a very tall head which needs to be corrected surgically, they in 100 years are not going to think that a dentist is going to do anything to them for this, so they're never going to go to the dental college.
That's irony.
So this is a wastage if we fix all these people only to dental colleges, and that is not exposed to the general hospital.
So that is where this lack of facilities in government hospital, was that the exact thing that encouraged you to set up Eastern India's first and only dedicated maxillofacial surgery hospital, as you call it, Calcutta Institute of Maxillofacial Surgery and Research?
Research. Yeah.
Your call, please.
Yes, it is. It is definitely one of the two main reasons. You see, when I came back from England, we must understand another thing. The training pathway of maxillofacial surgery in United Kingdom and in India have got differences. In England and in most of the North European countries, it is a dual qualification subject. So people can either come from medicine or from dentistry, but wherever they come from, they have to do the other degree. So all these people are qualified both in medicine and surgery. So the spectrum is very much wider than the spectrum of singly qualified maxillofacial surgeons of India. What happened here, whenever a singly qualified person, like you are in the media, you hear the voice of the people, and people hear your voice. People would have problem in accepting a person who is not a proper doctor, who is just a dentist, to be doing things like fixing the skull base tumor or fixing even a nose to that extent, or the eye socket. People get very confused about it. So what used to happen is the training was limited to jaw tumors, jaw fractures, and that's the priority that they always had in India. Whereas in United Kingdom, where I was trained, because all consultants were doubly qualified, their spectrum was the full platter. Nobody would ever have a doubt about that. So this training pathway being different, there was a need of advanced quality of maxillofacial surgery in the country. There were people who were returning and who were joining the corporate hospitals like I did. As soon as we came, we got entries, very warm welcome into the private sector in the corporate hospitals, and I was happy that I was getting the opportunity to do the job that I was trained to do. Problem began very soon that if I would see 10 people who desired or needed a surgery desperately, only 2 or 3 could afford it because it was so much expensive. It is incredibly expensive actually, because you would understand, when you are selling a product which is sold on a regular basis, then you can work out packages which are economical for them, like a laparoscopic cholecystectomy, taking out the gallbladder, or a bypass. Now, maxillofacial surgery was infrequent, and they were one of each kind. They were very separate from one another. So each surgery was packaged as one single case. So the price was hitting the roof. And because this was not a sure revenue producer, the corporate authorities were not willing to listen to the maxillofacial surgeon to make any policy decision of working out an economic and comfortable plan for the patients. And there were other sticky situations, as we can all understand, that when the corporate invests a huge amount of money, they invest it on a business. Whether the business belongs to the healthcare sector doesn't really matter that much. And as we discussed at the beginning of our discussion, my intention of getting into the territory was a little different. So I had a problem in accepting their philosophy of a balance sheet medicine. So these things together forced me to invest or put in. I would not mention invest, because I never made any profit in the last 12 years. So it is like I had to put in all that I earned in the 10 years of my training and practice in private sector to buy 2 small houses and convert them into the first ever maxillofacial institute of the eastern side of this country.
So can you give a slight comparative analysis of the price, of the cost rather, involved? We had this maxillofacial surgery, and a comparative between your hospital and the corporate hospitals.
That's what I will do. See, as I said, that there are 5 sectors, so I will give you 5 comparative costs. One is the dentoalveolar. Dentoalveolar starts anywhere between 3, 4, 5,000 and ends into about 15, 20, 25,000 in my place. Whereas the same would cost in the range of up to 60, 70,000 in the standard corporate scenario. In it can be much more, because these sometimes are done on chair OTs, operation theaters, and a chair instead of an operating table.
Okay.
So because most of the corporate hospitals don't have a chair OT, they would include the operating theater charges, bed charges, and such package system. So that makes them much bigger, and it could, like for a medically compromised patient who would like me to extract their decayed teeth which are infected, that will be done in what, 2,000, 5,000 rupees at the upper limit in my place. Whereas if I do that in a corporate hospital, in a bed, the patient gets admitted, the operating theater is used for the minimum amount of time, which is at least half an hour. The patient will definitely spend something in the range of 50,000 by the time he leaves the hospital, which sounds like really ludicrous. But anyway, that is the scenario. Because fractures can be of so many types. You can fracture one bone, two, three, multiple fractures. So on an average, a fracture patient ends up paying about, I'm going for the upper limit, 90 to 1,10,000 at the most in our setup. That same fracture would cost in the range of about 4 lakhs in a private sector, corporate hospital. We must also consider something. In the corporate hospital, the system of purchase of plates and screws which we put inside to fix the bone, that has got a official systematics of being purchased at a certain price and being sold to the patient at another price. So that makes about a 30% difference there straight away, and that is official on the bill. Whereas what we do, we actually allow the patient to meet the people who are selling these products, and they sell it directly to the patient. So that's a 30% there. So that's trauma. It is almost similar for cancer. So that is the other major cancer tumor. So we are looking at 90 to 1,60,000 is the spectrum in which the major cancer and tumor surgeries are done in our institute, whereas I do the same surgeries in the corporate sector in the range of 4 to 6 lakhs. That's the kind of my...
One last question. This I call it something out of the syllabus. Given another birth and given a choice, what would you like to be? A defense personnel, B, a bureaucrat, C, again a maxillofacial surgeon.
Well, if just these three are the choice, I am very much happier to be what I am now. I would be very happy to be a maxillofacial surgeon, because I can always return to be a bureaucrat. Probably not a army officer anymore, because that is not that much needed, at least in the present scenario of the world, because the bureaucrat will control the army officer anytime.
So there you heard Dr. Srijon Mukherjee, who made it big, who started with the mission of making the field of maxillofacial surgery a common name among the common people. And that way, in his hospital, the hospital set up by him, he is giving the patients an opportunity to get the treatment at much lower cost than the corporate hospitals. Thank you very much, Dr. Mukherjee, for being with us on studio.
Thank you. Thanks a lot.